Mr. Randall, please read the title of House Bill 1114.
House Bill 1114, by Representatives Janal and Buckner, all Senators Todd, concerning the regulation of genetic counselors.
Representative Janal.
Thank you, Mr. Speaker, or Mr. Chair. I move House Bill 1114 and the appropriations report.
To the committee report.
The appropriations report added a provision for $23,000 to the Department of Regulatory Agencies and 0.1 FTE and $7,000 reappropriated funds for legal services. I ask for an aye vote.
Is there any further discussion on the committee report? Seeing none, the question before us is the passage of the Appropriations Committee report. All those in favor say aye.
Aye.
All opposed, no. The ayes have it. The committee report is passed. Representative Janal.
Thank you, Mr. Chair. And I move the Health Insurance and Environment report.
To the committee report.
The HIE report clarified what boards certify genetic counselors, and it also clarifies genetic counselors according to the Medical Practice Act. I ask for an aye vote.
Is there any further discussion on the committee report? Representative Landgraf. Oh, excuse me. Is there any further discussion? Representative Buckner.
Yes, thank you, Mr. Chair. Genetic counselors are healthcare providers with significant training and expertise in genetics. This is a really important bill. I ask for an aye vote. And I would like to move the bill.
Thank you, Representative Buckner. The bill has been moved. We are still on the committee report. Is there further discussion on the Health Insurance and Environment Committee report? Seeing none, the question before us is the passage of the committee report. All those in favor say aye.
Aye.
All opposed, no. The committee report passes. And now we are back to the bill. Is there further discussion? Representative Janal.
Thank you, Mr. Chair. Clinical guidelines now suggest that incorporating genomic testing and therapeutics into medical care is vitally important, and it will continue to have a real impact on our lives and to help diagnose, prevent, and treat many human diseases caused by single gene disorders. Members, this is the way medicine is going. We need professional genetic counselors who are trained appropriately, up to date with educational requirements in this ever-changing field. I ask for an aye vote.
Representative Buckner.
Thank you, Mr. Chair. Genetic counseling offers several benefits to patients. Finding a disease-causing gene change can confirm a diagnosis when clinical diagnoses are not made with certainty. Treatment and prevention can be tailored to the risk conferred by specific genes and mutations. Identifying mutations in a family can help that family learn if they are carrying that same disease-causing mutation. Genetic counselors provide care that demonstrates both increased quality and cost-effectiveness. I am asking for an aye vote for this bill.
Representative Landgraf.
Thank you, Mr. Chair. We did hear this in committee, and I voted against it. I hope you will also. And one of the reasons, we just couldn't figure out why in the world this was needed. Genetic counselors do play an important role, but they've been doing that for some time without a license. There didn't seem to be any reason to add one. And I'm looking at this, and it says, a genetic counselor who graduated from a Colorado genetic counseling training program has at least 15 years of experience. 15 years of experience. That's a lot of experience to get a license.
Is there any further? Representative Ransom.
Thank you, Mr. Chair. And actually, I want to thank the sponsors. This bill was fascinating. We spent quite a long time in committee learning all about genomes and genetic work and when women are pregnant and having a baby and if there's issues with it. We learned a lot about the genetic testing. We got this wonderful chart that I'm more than happy to let people come to my desk and look at. It shows all the different genomes that they've mapped, and we learned so much about it. But like Representative Landgraf was just saying, we did hear testimony from people that requested that we not add this layer of licensing. While I do want people to be trained, while I do want people to understand and talk about the genetics to people that are asking the questions, there are also issues where the board certifies people, and a lot of times they might not have the level of the license to get to the license, but they still are board certified. And I know we had at least one person come in that her child had been born with a cleft, and she said that the doctor that delivered the baby and that they did some blood work, that was what she needed to learn, and that the OB was actually competent to give her the information that she needed. And to require this additional layer of licensing, we just thought was going above and beyond what is really needed for every single doctor. For people that have maybe complicated issues, that want to go to someone with 15 years experience, I would encourage them to do that. But again, to require it of everybody was something that we just couldn't get to that level. Although, as I mentioned, it really was an interesting, very intriguing bill to learn about. And again, I do want to thank the sponsors for teaching me a lot about genetics and genomes and how things are determined with blood work and the various ways that doctors have of determining all kinds of genetics. So thank you. Oh, but I do urge a no vote on the bill.
Representative Landgraf.
Thank you, Mr. Chair. I'm reading the ledge deck, and I'm a little confused because it says there is a public need for reliable and affordable genetic counseling services, which makes perfect sense, but then it says that a license requirement is necessary to meet this public need. So to me, that would actually go in conflict. And then it goes down to say, to allow people to choose from the broadest range of counselors. So we're actually taking people's ability to work away from them by requiring a license and then saying that people should be able to work, which is kind of contradictory. There just didn't seem to be a need for this. There was no evidence that there had ever been a problem with counselors. Nobody came forward to say they had had a problem. I'd ask for a no vote.
Representative Wilson.
Thank you, Mr. Chair. And for the bill sponsors, I agree with Representative Ransom. It was a fascinating conversation. But in tying in with what Representative Landgraf was asking, is there instance of harm, bill sponsors, is there evidence of harm? And if so, how does having 15 years of experience take care of that issue? They could be practicing, if I say this correctly, they could be practicing for 15 years and doing harm. And so how do we do that? I didn't hear in the testimony that without a license there was harm being done. So did I miss something on that?
Representative Janal.
Thank you, Mr. Chair, and Representative Wilson. Yeah, the 15 years of experience. Right now, if you look at what's out on the market that you can get off Amazon, the 23andMe and the other genetic testing, and you may get false positives, you may get false negatives. Are you going to? There's nobody to talk to about what you get as a result from those. Genetic counselors have 2 years, basically a master's degree in genetic counseling and genetics. And so I look at this as preventing patient harm because they work directly with the physician and they work directly with the patient. And it is, basically that's what they do is counsel. They don't tell you what to do. They counsel you on various ways of genetic testing for probably, diseases that may occur as you grow older, or if a child is born and you want to find out if they have a genetic defect on one of their chromosomes for whatever disease that might be that you're concerned about. Anyways, genetic counselors need to be licensed because a lot of them work in hospitals, and therefore the license needs to be married up to the hospital. And also, genetic counselors do practice on their own, but usually within a doctor's office. And doctors can also fall under genetic counselors because of their medical experience.
Representative Buckner.
Thank you, Mr. Chair. The senior lobby testified during our committee meeting, and they brought up something really important. Everybody's ordering these tests online. Have you heard of 23andMe? Trying to find, yes, Representative Young has heard of that. So many people have been ordering these tests online, and they've been getting false positives because trained genetic counselors are not the ones who are giving the information for these tests. So Representative Young, I hope you were not given a false positive. They said he was Irish. They said I was Caucasian. So, okay, that was going too far, but this bill creates licensure for genetic counselors under a director-run board. This is the least onerous type of regulation while providing protection for patients. By requiring a license to practice genetic counseling, there is a minimum education standard required, and consumers would have security in knowing they are receiving advice from an educated person, a person who really does have a degree in this area, and not someone who's just doing these tests to make money. There are also standards met by the National Association, including continuing education, which also removes a large burden of the process. This really is an important bill, and if I'm allowed to tell a personal story, I know someone who had to have genetic counseling for IVF. That is the only way they could conceive a child. And they made sure that they went to a licensed genetic counselor, because without that information, things could have gone awry. So I have a personal attachment to this bill because of this person, and I won't say who it is because I don't know if he's okay with it. Licensed genetic counselors require a master's degree education in genetics and must pass a certification test in order to be qualified. And Representative Wilson, Mayo Laboratory examined tests ordered for family members that they found were inaccurately diagnosed or inaccurately ordered, mostly by non-genetic counselors. So that's a waste of money and a lot of frustration for people who are ordering some of these tests online. So that's why I'm asking for an aye vote on this bill.
Representative Beckman.
Thank you, Mr. Chair. Just to clarify, this bill isn't going to outlaw like mail order, 23andMe, and genetic testing. People have been doing that and will still continue to do that. Also, currently, genetic counselors already have to have a master's degree, and they have to pass a test that does nothing to do with being a licensure or being approved by a board. So those things are going to continue to happen. We had a really good discussion about how genetic counseling can be a very personal issue, and sometimes family doctors and Christian counselors will dip their toe, even though they aren't the experts, and do some counseling. So there was some concern about that. But the real concern I have with the bill is how aggressive it is on the timeline. This bill enacts Genetic Counselor Licensure Act. On or after June 1st, 2019, a person cannot practice genetic counseling without being licensed by the Director of the Division of Professions and Occupations in the Department of Regulatory Agencies. That's a pretty fast track. I don't really support them moving into the licensure. I think it's an overreach, and I don't think it's needed. But this is a very fast track for those that are out there. And I really do think that it will narrow opportunities for people to get genetic counseling. I would ask for a no vote.
Is there any further discussion? Mr. Minority Leader Neville.
Thank you, Mr. Chair. Thank you, members. Members, this bill is concerning the regulation. I think right there is enough to say that we should vote no on this bill. But I do want to point out, too, that the legislative declaration also says there's a need for reliable and affordable genetic counseling. Members, regulation never makes anything more affordable. Vote no.
Is there any further discussion on House Bill 1114? Representative Janal.
Thank you, Mr. Chair, and I just want to ask for an aye vote on this. This is a very important bill, and licensure is important in regards to the practice of genetic counselors. First of all, without licensure, they won't be able to get malpractice coverage. Imagine that you're getting a genetic test and you come up positive for breast cancer, but it really is a false negative. So you've had surgery, but it was negative. You need someone who's going to counsel, not make decisions, but work with a medical doctor, work with the patient, and know what genetic abnormalities they are. Misinterpretation of tests is what I'm very concerned about, and what the genetic counselors are concerned about if there is not licensure. So I ask for it, and I vote.
Is there any further discussion on the bill? Seeing none, the question before us is the passage of House Bill 1114 as amended. All those in favor say aye. Aye. All opposed, no. The ayes have it. The bill passes.